In the following instructional video, Mike Haight, pharmacist at Abbott Northwestern, explains how to prepare an IV pediatric medication which requires additional dilution after reconstitution.
So we're here to talk about preparing sterile IVs. Something that'll probably come up occasionally, but not real often. I think my focus on this has been to try and set up sort of a system that you kind of know how to approach working over in this space. We've got our book that has really good instructions on any of the particular items.
Hold it up so that everybody can see the book.
You need it over here anyhow. So we've got our book, the pharmacy reference, and the tab in here is the IV compounding reference, and that has good detailed instructions on any of the items that you have to make. But just kind of a sense of overall, you know, what should you expect to be doing when you're working in this space? What's standard practice? That sort of thing. Obviously, we work in pharmacy where we have a lot more equipment and details and things to worry about, so I'm trying to keep it simple and straightforward and focus on just what you really need to know. So I've kind of broken it down into 3 steps that when you're going to make an IV, first thing you want to do is make sure you have your workspace ready. Before you mix anything, then you want to get yourself ready. And then once you've done those things, then you can go ahead and start your work and work here so that you don't need to leave, you don't need to step away, you don't need to refer back to anything, that you know what you're doing before you start mixing something. So to get your workspace ready, first thing that you want to do is get all your supplies ready. So what I'm going to do now is a pediatric unison. So I've got my drug vial, I've got my diluent that I need to reconstitute it, I've got the dextrose solution that I need to get the final volume, I've got my needles, swabs, syringe, got both my syringes. So these are all the supplies that I need. If you need some help figuring out, you know, what am I going to have to use for this, all those things are listed at the top of each of the drug items. So I've got all the supplies that I need. Next, I want to clean the space every time before that I use it. I'm going to use the germicidal swabs for this, wipes. Throughout our space. Washing hands too, something you want to do before you start, and wearing gloves is a good idea anytime that you're working with an IV. So I'm going to go ahead and get some gloves on. Touch contamination is probably the #1 issue that you're going to run into. You know, as long as you've got all your instructions, your drug and everything like that correct, your hands and just bumping things that need to be sterile, that's where your greatest risk to the patient is going to be. Alright, so I've got my workspace ready. Now I say I want to prepare myself. So hands washed, gloves on, and then I want to know what I'm doing before I'm starting. So I've got my drug in my vial, all these supplies ready to go, and now I don't have a label here for the order, but obviously that's something that you're going to have. You're going to have the patient dose, whatnot, those things. And you want to take a look at the volumes, the measurements, the dose, and make sure that you understand exactly what it is that you're doing before you start mixing, because you don't want to have to interrupt yourself and go back to your book. You know, if you're over here concentrating on something, you don't want to have to stop and look back. So I'm going to, for this unison, figure that we've got a 20-kilo patient. The dose is going to be on your label, but I can use this chart to figure out that for 20 kilos, I'm going to need 3.2 mLs of drug out of my reconstituted vial, and then 36.8 of dextrose to get my concentration that I'm going to administer. So once I have those things figured out, you know, you've got 2 sections on your label, the one that goes on the final product, one that has preparation instructions. You could write those down so that you have those set, ready to go. That's something you can glance back at quickly, rather than having to find it again back on this chart, maybe getting your lines confused and measuring things incorrectly. But those are the questions that you want to resolve before you're starting, you know, before you're in the middle of mixing, where I've got my syringes and my needles and I've got everything put together, but now I forget what was that supposed to be. So prepare yourself before you start. I'm going to go ahead and I'm going to do. All right, this is a second admixture I'm going to make so that we can address the issue of labeling the syringes during the course of putting this together. For Joint Commission, we don't want to be setting down any syringes that aren't labeled that have drug in them. And I'm going to talk about using the Excellion label, which this is what prints immediately before you start doing this work. Using part of the Excellion label to label those syringes as you're working with them so that we're meeting all those requirements. So I'm going to go through again, reconstituting and then measuring out my dose and my drug vial, filling it here. Swab my vials, and again I'm going to use 3.2 mLs to reconstitute. Once I have the drug constituted, drawn out, that's when I need to be sure to label that in the syringe. Measured. Set this down so I can check that up. Okay. Then I can draw up the dose that I need, which is 3.2 mLs. And at this point, this is when I want to use part of my label, since we have active drug in here. We don't want that sitting around the label. That allows me then to move on to the dextrose, so I can draw that up for the final dilution. In this case, we need 36.8 mLs. And this is the point where it's most helpful for a nurse to do the double check, because we have both of the volumes drawn up. The second nurse can check both of those volumes before they're mixed together in the final syringe. That's the most safest way to make sure that those volumes are correct and everything's been measured correctly. So once that's been done, I'm going to add my drug to make my final dilution. This syringe is my final product. I can receive the product label. At this point, you can attach the administration tubing to cover up the syringe tip, and this will be assigned to 1 hour expiration, and then it's ready to go.